So thank you very much for joining us today. I'm going to introduce our two speakers today for our workshop called Mind Over Matter, Fact or Fiction. And I'm very excited to have both Dr. Sherry and Ann Lyle here today. I'll give you a brief bio about both of them and a fun fact, of course, because I think it's always good to have some kind of icebreaker, I guess, if you will. But I'll do that after I just briefly introduce the conference and make an acknowledgement that we're hosting this event on the traditional, ancestral, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And we are very happy, especially in British Columbia, to live, work, and play in this beautiful region. Our Women's Health Cluster is hosting these Brain Health Virtual Conference. We're supposed to meet in May 2020, but of course we are unable to do that. So we are running a monthly series. Today is the workshop. We have a lot of sponsors. We couldn't hold these events without our sponsors that are listed there. If you want to engage with social media, you are more than welcome to, and that's our hashtag there, Women's Brain Health Conference 2021, because we're in 2021 now. So if you want to follow a conversation on social media, please do that. You can always tag us, and also please consider joining us, which is quite easy. You can just do Women's Health Cluster research on Google or whatever your search engine is, and there's even a Become a Member button there. And we do rely on donations, so please consider supporting us, which there's a donate button now on our website as well. So I'm going to stop sharing my screen here. And while I do so, Dr. Sherry Hayden can start to share her screen, and I will introduce them both while you are doing that. It will take her a moment anyway. So Dr. Hayden, it's really my pleasure to introduce Dr. Hayden. She's a clinical neuropsychologist and a clinical assistant professor in the Division of Neurology, Department of Medicine at the University of British Columbia. I've known her for quite a while. Often when we have meetings, we have to schedule a little longer than we normally would because we like to talk to each other. She served as a clinical neuropsychologist at UBC Hospital in the clinic for Alzheimer's disease and related disorders for over 27 years. She's completed an AFMCP certification through the Institute of Functional Medicine, a culinary medicine health coaching certificate from the Harvard Medical School, and is a member of the American College of Lifestyle Medicine. In addition, Dr. Hayden has completed a yoga teacher training and is registered with the Canadian Yoga Alliance. Dr. Hayden applies functional and lifestyle medicine principles throughout her clinical practice. And I have seen this firsthand when my mom used to attend the clinic. And so, as I said, I always ask for a fun fact, and Dr. Hayden's is a good one. Despite always having been picked last for all the teams in high school gym class, I was right there with you, Sherry. She took up snowboarding at 45 and surfing at 50, and I can attach to that because her Instagram is all surfing videos, pictures. So a nod to my fellow late blooming sporty nerds, and she gives a wink. Ann Lyle, who will talk after Dr. Hayden, has worked as a neuropsychology technician in Alberta and British Columbia for over 23 years. In addition, she has extensive training in crisis prevention and stress management. She's facilitated stress reduction and mindfulness groups in various hospital community settings and has completed a yoga teacher training with registration with the Canadian Yoga Alliance and integrative health coaching certificate through the Nickerson Institute. Dr. Hayden and Ann Lyle are partners in Synaptic Travels and Wellness. It's synaptictravels.com. So I urge you also to put that in your Google or search engine as well. And they provide preventative brain health consultations, workshops, and retreats for women. And Ann's fun fact, her motto is, how bad can it be? So when she's invited to participate in some kind of challenge, this is, she thinks, how bad can it possibly be? And so it's resulted in some very interesting situations, like the time she rode her bike from Edmonton to Vancouver. And she says, and yes, at times it was pretty bad. But without further ado, I will mute myself and hand over the mic to Dr. Sherry Hayden. Thank you very much, Sherry, and
Thank you.
Audibly clap.
Okay, great. Thank you very much, Lisa. Well, welcome everyone to our workshop on mind-body practices and women's brain health. I do understand that the audience comes to us with a wide range of backgrounds. So our hope is to cover a lot of material, nothing in great depth, but really I'm hoping that something tweaks the interests of each of you and you might explore this area further. So let's see. Oh, it's not. There we go. So I thought I'd talk a little bit about my own experience and how that led me to this area in clinical practice. I love this cartoon because it's how I feel much of the time. And really my interest came to women, focusing on women's brain health, really when I became pregnant at 39. Now I had been practicing as a neuropsychologist for about 10 years at that time and had a reasonable amount of confidence in my own cognitive abilities. And then I got pregnant and really suffered a great deal of cognitive change that was really kind of interfering with my functions, both at work and at home. For those of you that are less familiar, as a neuropsychologist, my job is to assess people's cognition, so their memory and language, different areas of their thinking. With the help of Anne, we test those areas, which creates, in a way, a map of your brain function. And that allows me to give opinion about diagnoses and management issues, which I had been doing for 10 years. And then I got pregnant and had trouble even remembering a patient's name. If I was reviewing a chart in my office 5 feet away, I'd go and call the patient. I had looked at that name like 30 times as I'm looking at documents. I'd walk into the weight room, nothing. And so that was frustrating. I also had a lot of trouble with word finding. So I would be in meetings, and in my case, that means I'm in clinical meetings with all male doctors and myself. And I would have trouble even asking for a pen because I couldn't get the name of pen. So at best it was humbling, at worst it was humiliating. And it made me start to think about what is going on with my brain and these hormones. Around the same time, interestingly, there was a shift in the clinic population. So we serve the whole province of British Columbia, looking at people who have concerns for their memory with the consideration of possible forms of dementia. And as my practice began and continued, we started to see a change in the type of patients we were seeing. We were seeing patients earlier in the disease process as well as preclinical. And so I was beginning to see women that were usually in their 50s-ish, who were menopausal, perimenopausal, who were describing very similar symptoms to those that I experienced when I was pregnant. I had my second baby at 41, and then I pretty much, slid right into perimenopause. So really it became a big area of focus for me. And I really needed, I needed for myself to explore interventions and management options to address this issue. So really, the reason that I came to this is largely, or it started with self-interest, and now it's sort of moved into clinical care. So that's how I came here. But let's talk about, what the women's brain health risks are in Alzheimer's disease. And some of this is kind of daunting, but remember, we will talk about some of the good news later on. We do know that 2 out of 3 Alzheimer's patients are women, and that statistic cannot be accountable by differences in longevity in men and women, so that's important to know. Despite the fact that breast cancer is often identified as women's biggest fear, the reality is women in their 60s are twice as likely to develop Alzheimer's disease over the course of their lives versus breast cancer. And a 45-year-old woman has a 1 in 5 chance of developing Alzheimer's during her lifetime versus a 1 in 10 chance for same-aged males. So it's a little daunting. It's also important to acknowledge, which is that graphic below, that the majority of caregivers and carers, whether that's in their personal lives or in their occupation, are women when it comes to caring for patients with Alzheimer's disease and dementia. And with that comes a lot of stress. And we will talk about later how stress is actually a risk factor for brain health. And unfortunately, it's not just dementia that we're at higher risk for. There are many other things, and I thought I'd just sort of touch on some of these. We know that women are twice as likely to have clinical anxiety or depression than men. Women are 3 times more likely to have autoimmune disorders, including those that affect the central nervous system, such as MS. Women are 4 times more likely to suffer from migraines and headaches. And women are more prone to developing meningiomas, which is the most common type of brain tumor relative to men. Women's mortality rate is higher than men's for stroke in the first year. A woman is 50% more likely to die than a man following their stroke. And women experience more symptoms when they've suffered a concussion or traumatic brain injury, including menstruation change, and they take longer to recover. So that all sounds horrible, I know. But the reality is, it's important to know that your genes are not your destiny. And we do know in dementia that about 35% of those risk factors are what we call modifiable, meaning that they're changeable. And so that's important to hold on to. And in fact, the World Health Organization has put out guidelines for risk reduction of cognitive decline and dementia. And most of those interventions are lifestyle interventions, things that you have control over. And the rest of them are really medical management of chronic disease. So there certainly is hope. But I did want to touch on some of my own clinical observations when it comes to the front lines, where I've been for the last 27 years. And I'm hoping that we do better here. And that is that certainly in my experience, sex-specific brain health issues are under-addressed on the clinical front. And I think we have to consider the context. The reality is, in the practice of neurology, which is where our clinic is situated, female clinicians remain a minority. And certainly that's the case for my clinic. There's 1 female for every 3 males. And so that's a challenge because, obviously perspective impacts how a clinician might practice. The other thing is that there is no sex-specific clinical treatment protocols, despite the fact that there's a higher prevalence of dementia cases in women. And so, we need to move towards that a little more clearly. And I wanted to mention the last point here, just because I think it really does affect care. And that is clinically, women are more likely to be identified with psychosomatic symptoms or symptoms attributable to emotional distress than males with the same symptoms. And this gender bias really goes through various areas of medicine. And unfortunately, it's the case for both male and female clinicians. So it's not just male clinicians that are behaving in this way. It really is a bias that we have clinically, and we need to do better. We need to consider that when we're hearing women's symptoms. And I know myself, I'm sure many of you out there have been in a situation with a healthcare provider where you might feel invalidated or unheard when you're talking about your symptoms, and that really isn't helping us at the clinical front, where it can be very complicated. Having trouble shifting my. Oh, there we go. But the good news is that women are actually more likely to engage in preventative health practices like these beautiful, beautiful women here. I want to grow up to be like them. So what is preventative brain health? Well, there's many different models. I like this one from the Global Alzheimer's Foundation because it really covers a lot of things, including research. And what we know is that there's many components, many what they call here pillars to keeping your brain healthy. And that would include physical exercise, so staying active, nutritional considerations, eating well, sleep hygiene, so trying to maximize the quality of your sleep, exercising or stimulating your brain, Connecting with family and friends, so reducing isolation, which we've experienced during COVID is a challenge, but we've tried to create new ways of doing that. Reducing stress, which is really what this talk is focused more on, but I wanted to, of course, acknowledge all the aspects of brain health. Controlling medical risk factors, so you have to do that as well. And what I like about this model is that it also includes getting involved in research, because really, as a clinician, I do get involved in research. I don't really have time to lead research, but I've had the fortune to work with Lisa, but also other researchers, and I really value it. As a clinician, that's what guides us, and we need more of it, and we definitely need more of it in this area. So on the clinical front, the interest and support in preventative medicine is growing, which is encouraging, including references to mind-body practices. You can see here on the websites for Vancouver Coastal Health, which is my health authority, where our clinic is situated, as well as for the Provincial Health Link BC. There are actually pages dedicated to mind-body practices. So that's encouraging. What's also encouraging to me is the opening of centers such as the Alzheimer Prevention for Women Clinic at the Cleveland Clinic. I think it might be one of the only clinics like this in North America. And if it's not the only one, it's one of very few. Of course, my hope is that we would move towards having many of these to be accessible to all women, but we unfortunately aren't there yet. So I thought I'd just touch on what mind-body practices are for those of you that might not know. Anne is going to go into a little more depth of definition of what these practices are, but I'll give you a general idea. So when we're talking about mind-body practices, we're just talking about those practices that involve mental focus, some type of controlled breathing or awareness of breath, and some form of movement. And it doesn't have to, the practice doesn't have to include all of these things, but typically includes some combination. And that would mean practices such as meditation and yoga, which is what Anne and I will focus on, but also includes Tai Chi and various forms of mindfulness. So it's a wide range of practices that we can consider. We also, I wanted to acknowledge that mind-body practices are really considered a type of complementary medicine. And by definition, complementary medicine means it's meant to complement, not to conflict with conventional medicine. And the great thing about much of these interventions is that they're easily integrated into conventional medical treatment protocols or treatment plans. So as I mentioned earlier with the pillars of brain health, management of stress is a big one. And we do know that stress in a woman's brain is a little different than it is for men. We know the evolutionary stress response in women is perhaps a little more cerebral. It's been called the tend and befriend response, where one is prone to protecting oneself and one's offsprings, as well as creating social networks to provide protection from threats. In addition to the physical fight-flight response that we're familiar with from the sympathetic nervous system. We also know that women under stress have particularly strong and longer activation of the limbic system with greater functional connectivity, meaning communication between areas of the brain, and increased oxytocin, which is the love hormone, and likely contributes to the need to tend and befriend. In addition to the cascades of cortisol and adrenaline that we know occurs with fight-flight. Oh. Let's see. Oh, there we go. So how we manage it depends on first acknowledging it. And I love this cartoon because it reminds me of a situation that Anne might recall where I had walked into her office. I don't know if you can see me, but I'm holding my phone in my hand. I was in a panic because I had a lot going on that day. I had a big call that I need to make with a lawyer about a medical legal case, and I was stressed out. I walk into her office, my phone in my hand, and I'm patting down with my other hand going, Anne, I can't find my phone. Oh my God, like I need to find my phone. Can you help me? And being the gracious soul that she is, just smiled at me, looked at my hand, looked at my face. That cued me to look at my hand, and we had a good laugh. I do tell my patients that, you know, these things happen. Obviously, if you have incidences like that continue or persistently affect your function and are getting worse over time, you should talk to your doctor. But the reality is that when those things happen sporadically like that, we need to take a moment to reflect on what's going on, and is stress a factor here? Obviously, I had a lot going on in my head as well as in my practice, and I wasn't paying attention to where my phone was when it was already in my hand. So, I like to share that with you, but also I do share these things with patients to give them a sense of normalcy. But we do know that mind-body practices such as yoga and meditation are particularly effective tools in managing the stress response. But as I said, we need to come to this as this is one of the toolboxes that we use clinically. And for those that are experiencing sustained extreme stress with clinical levels of depression, anxiety, and that sort of thing, we want you to pursue more conventional treatments like psychotherapy and psychiatric consultation, of course. So let's talk a little bit about the popularity of mind-body practices. We do know it's growing. This data is from 2018, and I suspect it continues to grow today. We know that the use of meditation increased threefold between 2012 and 2017. Yoga increased in about the same amount of time by 50%. The use of meditation is highest among adults between the ages of 45 and 64. And yoga is most practiced in those aged 30 to 49, followed by those over 50. Women are slightly more likely to engage in meditation than men, about 16% to compare to about 12% with men. But women are much more likely to practice yoga. 72% of yoga practitioners are women. And we know also that the interest in research is growing as well, as we can see references to meditation, yoga, and mindfulness between 2000 and 2013. There's an exponential growth in the number of publications listed in PubMed. So that's all very encouraging. I thought I'd take a few minutes here just to talk about the research. I can't go into depth due to time, but I'm hoping this will tweak your interest and you can explore some more yourself. Sarah Lazar out of Harvard is one of the leaders in this area. She has a long-standing lab in the neuroscience of yoga and meditation. One of her interesting studies has been that 8 weeks of daily meditation increased hippocampal volume, which, by the way, the hippocampus is one of the first areas affected in Alzheimer's disease, as well as volume of the posterior cingulate cortex. There's decreased involvement in the amygdala, so we know this reflects issues with anxiety and depression in this area of the brain. She also found in other studies that 50-year-olds with longer-term practices of meditation or yoga did demonstrate slowed down age-related atrophy and structural brain change compared to what was expected for age. And it's not just this lab that is demonstrating this. Other labs, such as Vaso in 2012-13, demonstrated that meditation does affect multiple brain regions, mostly frontal regions, the hippocampus and cingulate cortex, similar to the previous slide. And it's not just experienced practitioners. This study with Vaso in 2019 revealed that brief, meaning about 13-minute podcast directed meditation daily, resulted in changes in the hippocampus and prefrontal cortex, as well as enhancement of areas such as attention, memory, mood, and emotional regulation. And we're seeing similar findings for not just meditation, but for yoga. Afonso in 2017 studied a group of, he called elderly, which I found offensive. When I looked at the definition of that, it just was anybody over 60, but women over 60 who were practicing yoga demonstrated increased cortical thickness in their left frontal lobes. And the same group looked at yoga in postmenopausal women who were practicing twice weekly for 4 months and demonstrated increased serum estrogen levels. So this is all very exciting from that front. We are also seeing some interesting research in the cognitive area. So research is suggesting, there's several studies that suggest yoga practice is correlated with mild to moderate improvements in cognitive function. Typically, the strongest effect is in the area of attention and processing speed, with lesser degree effect in executive functions. So things like your planning, problem solving, your ability to juggle multiple things at once, as well as your memory. So all of this is very exciting, and it gets me very excited to share this with you and talk about it. But I think we do need to acknowledge that this area of study is in its infancy. And critical review of the literature does reveal methodological limitations in those studies that we need to, that should inspire us perhaps to pursue further research. My hope is research will focus on sex-specific impact of these practices, as well as studying the impact of specific practice dose. So what type of practice, which Anne will discuss, as well as how frequent. I think we also, as researchers and as clinicians, need to acknowledge the limitations of these practices and possible adverse reactions. There are studies that suggest that meditation, for example, is contraindicated in some psychiatric populations. We want to limit public misinterpretation and false expectations about outcomes, so we need to be aware of that. And finally, I just wanted to talk about my hope for the future. And that would be what I've listed here. My hope is that we include preventative lifestyle medicine practices in conventional healthcare. I believe that will improve clinical outcomes. As a clinician, patients rarely come to me with a clean and straightforward presentation. It's always complicated by a number of factors. And so I need a toolbox of things that will help me care for my patients, and as well as I need that toolbox to care for myself. We need to integrate precision medicine protocols for sex-specific prevention and treatment in brain health and disease, and we're a ways away from that. I also urge clinicians to become better versed and educated in complementary medicine approaches. As Lisa said, I took it upon myself to pursue training in functional medicine, lifestyle medicine, and now culinary medicine, so that I might better serve my patients, but also better serve myself. And I believe that's where we can help women in the preventative means of managing brain health symptoms. And I also hope for those researchers out there that you've had some interest tweaks so that you'll explore further the outcomes of mind-body practices and lifestyle interventions in women's brain health. So I'm going to leave you there. This is a slightly blurry picture of my dog. Her name is Stella. She likes to do downward dog on my yoga mat whenever I try to practice. I'd like to thank you all for your time, and I'm hoping that Anne has been able to enter into the community here. So I will stop sharing and we'll see where we're at.
She is here.
Oh, good. Oh, good.
But I'm going to show her slides. So it'll be me showing her slides. I'm wondering if we can, yeah, I really loved your talk, Sherry. Like, okay. And I've known Sherry for a long time, but I'm super excited. And as a researcher, I really want to start doing some more research in this area. I have a lot of ideas for you and I, my friend, but I won't bore everybody with that. I'm wondering, do you want questions now or at the end after? And
if there's questions, I can answer a few now if Anne needs a few minutes or whatever, or we can do it after, whatever.
Well, I think we're all set for Anne. I have.
Okay, well, why don't we go ahead with Anne and I can answer after.
Okay, because I have questions for you, but nobody else does. But you know, where is that? Oh, so
I'm going to mute myself.
Yes, you can mute yourself. Wow.
Okay, and I'm unmuted and I'm on video.
Okay, yes, I see that, which is great, but you probably don't see my screen because I haven't started sharing yet. I need to find the, so sorry, everyone. You know how many times I've done this? A million times, but somehow, there it is. Great. I couldn't find it. It was kind of like Sherry's example of having the cell phone in her hand, but she couldn't find it because she was distracted. So that was what was happening to me right in front of me. So here you go, Anne. I'm going to mute.
All right. Hi. Thank you so much. So I'm Anne Lyle, and I'm just going to talk about one of the 8 pillars of brain health, that being stress management. Primarily, I think stress management is one of the most vital parts of brain health, and it often gets overlooked. Yet, stress can have an incredibly negative impact on our cognition. So I'm going to talk specifically about meditation and yoga, because these are the two mind-body practices I'm most familiar with. I've practiced yoga for 21 years, and I've meditated off and on for most of my adult life. So one of the theories about how meditation and yoga help manage stress is related to how stress activates the autonomic nervous system. A person may become stuck, that is, they aren't able to return the autonomic nervous system to a state of rest and digest, and they're in a chronic state of fight or flight. So this can happen for a variety of reasons. It can be related to a person being exposed to multiple stressors over an extended period of time, or it might happen after just one exposure to a traumatic event. When your body's in a heightened state of arousal, it's on the defensive. So when in this state, it doesn't matter whether or not your perception is accurate, your brain and body are stuck in fight or flight and perceive that threats are everywhere in your environment. So while it's perfectly normal to have a physical reaction to a perceived stressful situation, such as having to give a talk, and let me tell you right now, my hands are sweating. Most of us, when that talk is over, will return to a normal, state of homeostasis with a reduction of adrenaline and cortical production. When you're in a state of chronic autonomic activation, though, that normal stress response becomes amplified and can result in a whole host of different physical and psychological problems. And so being in a constant state of fight or flight can be quite debilitating. The idea behind mind-body practices are that they act as a trigger to help put the brakes on a mind that's racing out of control and allow that mind to consequently the body to return to a state of relaxation. So you can tell by my first slide that we're going to talk about the different types of yoga. Yoga is a word that's derived from Sanskrit, and it means to unite or to yoke, where the aim is through practice to bring harmony between your body and your mind. Hatha yoga, the first term on that list, is a generic term that encompasses any type of yoga that teaches physical postures, which are known as asanas. Classes described as Hatha yoga generally are geared towards beginners and introduce basic postures that are common in all types of yoga. The next one is Iyengar yoga, and this is a specific type of yoga developed by BKS Iyengar. Special care and attention are paid to the alignment in this type of yoga. Mr. Iyengar emphasized finding the correct body alignment by using props such as blocks, straps, chairs. Really anything in your environment can be used as a prop. I myself have even used park benches. So the props help to get your body into the correct shape in a safe manner. This type of yoga can be practiced throughout your life because the props also help you compensate for the changes that happen as we age. And believe me, they happen no matter who you are. So Mr. Iyengar died several years ago at the age of 96, and he was still able to practice his poses until 1 month prior to his death. So I think that's fairly good advertising for that type of yoga. Next, we have vinyasa. Vinyasa yoga is a practice of movement through breath. You move through a series of poses in coordination with your breath. The classes often have a theme such as gratitude or peace, and the poses are designed to help you move towards that goal. There's a great deal of variety allowed in the vinyasa class, and the sequences in the poses varies. The classes are a bit more physically demanding because you're flowing from one pose to the next, but all poses can be modified to fit the student's ability. The thing to remember is that in all yoga, it's an individual practice. So while we often go to classes and we practice together in groups, in non-COVID times, of course, it's not a competitive practice. You're not competing against each other, but you're just listening to your own body and what your body allows you to do. Ashtanga is a power energetic form of yoga that's similar to vinyasa, except that there's no variation in the poses and the same sequence is followed each time. It can be a bit daunting, but when practiced with a good teacher, it can be modified for a beginner. And once again, it's a type of yoga that anybody can try. The goal of Kundalini yoga is to release that pent-up energy that's stored at the base of the spine. In fact, the word Kundalini itself means coiled like a snake. So the breath work and the asanas practiced in Kundalini help to unblock chakras or energy centers, and then release that energy into and increase your self-awareness. There's a heavy emphasis on breathing and meditation in Kundalini classes with less emphasis on the poses. The focus of yin yoga is to release the tension in the joints, such as at the ankles, the knees, the hips, the back, the necks, and the shoulders. Who doesn't need that? And the pace is slow and the poses are held for an extended period of time, thus allowing gravity to help you sink into the pose, while faster paced yogas like Ashtanga and Vinyasa focus on your muscles. Yin yoga focuses on your connective tissues and uses your breath to help you breathe through any discomfort you might have when you're holding the poses. And finally, we have restorative yoga. It's the most relaxing and least physically challenging style of yoga. However, if you're not comfortable spending 10 minutes in gentle supported poses, it can be taxing. The real challenge in this style of yoga comes from trying to quiet your mind without having any kind of movement to distract you. So I didn't add hot yoga to my list because many of these styles of yoga are now practiced in hot yoga studios. Back in the olden days when hot yoga was first practiced, it was in a room that was really stifling hot and it sort of smelled like a hockey bag. But the practice itself has morphed over time and it's much more civilized. And the room's not quite as hot, and believe me, it's not as smelly. So the advantage to practicing yoga in a hot room is that you're much more flexible. You burn more calories than you would in a regular class. And you also increase your lung capacity. One of the downsides is, though, it's a bit more intense. So you might overdo it and end up a bit dehydrated and you could injure yourself. However, the key to success in any yoga, whether it's hot or not, is just to listen to your body and to be your own guide. So my take-home message about all yoga is that there's many different types. And if you go to a class and you don't like it, try a different class. The cognitive and physical benefits of yoga make it a really worthwhile pursuit. So now we'll move to the next slide. We're going to talk about meditation very quickly. We have mindfulness meditation, which is basically the non-judgmental observation of your thoughts, feelings, and physical sensations. And actually, there's an element of mindfulness in all meditation, but mindfulness itself is an entirely different pursuit as well. So focused meditation is where you concentrate by using any of the 5 senses, such as touch, sight, or breath. One I like to use is when I'm on the bus, I like to focus on the colors that are in the environment as the bus goes down the road. So I'll look for orange, I'll look for green, and it helps to distract and quiet my mind so that I'm not as annoyed by the people around me, which if you've ridden the bus, you understand there's a lot of annoying people, including myself. And, I get to work feeling a little bit more calm and a little more peaceful. The next one, movement meditation. Yoga is a great example of movement meditation. It requires a degree of concentration and attention. You have to be in the present moment as you move through your poses. But really, any physical activity that you do with an intent or mindfulness can be a movement meditation, such as walking, swimming laps, anything like that. Next, we have progressive muscle relaxation and body scan. And visualization. So we use visualization to promote calmness through visualizing positive scenes or images. In other words, you're going to go to your happy place. So you can also use visualization to increase your focus and motivation and see yourself succeeding in specific situations. Then we have progressive relaxation and body scan. These are practices where the goal is to notice areas of tension in the body and then release that tension. It's a really good practice to do before going to sleep because you can release all the tension from the day and put yourself into a restful state. And we have mantra meditations, which is just the repetition of a mantra or a sound like om or chanting. Loving kindness meditation is an example of a mantra meditation. And it's where you repeat a phrase of loving kindness over and over again with a whole intention of creating feelings of compassion and love for yourself and others. And the final 2 are more spiritual pursuits. They're transcendental meditation and Zen meditation. And they're much more structured than the others. They're usually taught by a teacher. And there's very specific steps to moving through these meditations. So now that we've done talking about meditation, I'd actually like to practice a little meditation. So if we can move to the next slide, there we go. So I'd like you to follow along with me as I practice a simple breathing technique that's used to activate the parasympathetic nervous system and that it allows our bodies to relax. This type of breath work helps to stimulate the vagus nerve, which is responsible for most of the parasympathetic messaging from the brain to the body and from the body to the brain. 80% of the fibers of the vagus nerve communicate the state of your body to your brain. So through deep breathing, we're controlling the muscles of our larynx, and this in turn helps to stimulate our vagus nerve. So in other words, if you gulp your air, your brain perceives that it's in fight or flight. And if you let your air in slowly, then you return to a state of rest and digest. So it's really important when we're practicing this breathing to breathe in through the nose as it promotes proper oxygenation of the body. And then when you breathe out, make sure that the breath is long and slow, as it's going to calm down your nervous system. It'll slow your heart rate and it'll reduce any feelings of anxiety and stress. So with this breath work, we'll start out with our in and out breaths being equal length with no pause between the breaths, and then gradually build up to our breath being longer, our out breath being longer than our in breath. And then for the final round, we'll add a short pause at the end of each out breath before taking the next breath in. So if you find your mind starts to wander during this, just focus on the sensation of your breath. Feel the air coming in through your nostrils and as it flows out through your mouth. So I'd like you to start by sitting up comfortably in your chair and feel your back pressing into the back of the chair. Feel your feet against the floor and take a deep breath in and out, feeling your body melt into the chair as you breathe out. If you feel comfortable doing so, allow your eyelids to gently close. And if your eyes are open, lower your gaze so that you're looking softly at your lap. I'm going to begin counting our breaths in and out, and I'd like you to follow along to my count. If the breath feels uncomfortable or strained, go at your own pace. Remember, this is supposed to be relaxing and shouldn't make you feel like you're racing to catch the last bus home. Take another deep breath in through your nose and let all of the air out through your mouth, preparing us for our first round of counting. And we'll begin. Breathe in through your nose. 1, 2, 3, 4. And breathe out slowly through your mouth. 1, 2, 3, 4. And again, breathe in 1, 2, 3, 4. And breathe out 1, 2, 3, 4. And we'll do this 2 more times before we start to increase the length of our exhale. Breathe in. And breathe out. Breathe in. And breathe out. Now we'll begin to lengthen on our out breath. So breathe in 1, 2, 3, 4. And breathe out 1, 2, 3, 4, 5, 6. Breathe in 1, 2, 3, 4. And breathe out 1, 2, 3, 4, 5, 6. We'll do this 2 more times. Breathe in. And breathe out. Breathe in. And breathe out. Now breathe in 1, 2, 3, 4. And breathe out 1, 2, 3, 4, 5, 6, and pause before breathing in. Now breathe in 1, 2, 3, 4, and breathe out 1, 2, 3, 4, 5, 6. Pause and breathe in and breathe out. And pause. Breathe in and breathe out. Pause. And now breathe in, allowing your breath to return to its natural rhythm. Slowly and gently begin to bring your awareness back into the room. Wiggle your fingers and your toes and allow your eyelids to open if they're closed, and raise your gaze and enjoy a feeling of relaxation and calm. So hopefully you all feel a little bit calmer than you did a few minutes ago. And if you found it hard to concentrate, that's normal. Meditation, like anything, takes practice. So I have it on the next slide, just a few tips to help you establish your own meditation practice. So the first thing is to make time and set aside a specific place for meditation. Routine will help you build your practice. Doesn't have to be long, especially when you're starting. Just find 5 minutes where you can practice some type of meditation. I had a manager who used to just close his door at lunch hour, and he'd spend 15 minutes meditating every lunch hour. We all thought it was a little bit weird at first, but we got used to it, and we kind of liked the way he was really calm. So it was pretty motivating for the rest of us to try and fit it in. Also, remember to be your own best friend. So no judgment. Your mind might wander, but think of yourself as an interested bystander. Your thoughts are like buses. They come and go, and you don't have to follow them. You just notice them and let them pass until the next one comes along. And finally, practice, practice, practice. The only way to get better at anything is to practice it. So remember, there's no right or wrong way to meditate. Whatever method you choose will suit you at that time of the day. By practicing a variety of techniques, you'll have several tools at your disposal that you can pull out whenever you start to feel your anxiety rising. So, and then really the key is to find a meditation that works for you. And that's why I had that list of all those different types, because not one practice works for everyone. So thank you so much for practicing with me today. And I understand Dr. Hayden and I will be here for a few more minutes to answer any questions. Thank you.
Oh, thank you so much. Yes, I really appreciated this. I don't know how many of you others in the audience. I've been told to do yoga. I've gone a few times, but we don't have to talk about my issues. But meditation's been another thing on my list to try. But everybody will sort of shove a certain, because they get a lot of benefits from their particular type of meditation, so they want you to do theirs.
Right.
So I really appreciated that it needs to be geared to you, right? So what works for you. And I will also so if people want to put questions in the chat or they want to unmute themselves, they're more than welcome to do so. But I just wanted to say that this weekend I listened to a podcast of Jerry Seinfeld. I think it was Tim Ferriss. And it was really interesting because he talked about that he does transcendental, is that what's called, meditation. So, and he does it every day. He does weight training every day, or he does like some, high intensity, and then weight training every day too. So I don't think he does yoga, but still, just listening to somebody that is so successful endorsing these, exercising your mind and body was really, I think, affirming, and should be to a lot of people. So a lot of what you said today really resonated. I've certainly been to yoga classes where I was a little distracted by them. So it's nice to see that there are many different types And that hot yoga no longer smells like a hockey bag, because that was not the nicest, I have to say.
Well, sometimes it still does, depends on who's in the room.
Yeah, exactly. I'll just have to like, go around and see. And yeah, I think it really does depend on the teacher, even if you have a particular yoga or a meditation that you like. So we have the other thing I was thinking about the vagus nerve. The other thing I think that it controls is the gut, right? The gut.
Yes.
And we know that there's so many gut brain interactions now in terms of the microbiota and how that also influences anxiety and depression. So that's another reason why I would assume breathing really does work to bring down that stress. One thing I'll say is while I was doing it, I found it hard to breathe in for 4 minutes. Like I am super stressed. I clearly my stress levels are like way up here because even the breathing was hard for me out. But after a while, I got it. So you're a very good teacher, Anne. Thank you. But is that normal? Is that normal that people?
Yeah, I mean, even myself, the first couple breaths are always a little bit, okay, hang on, what am I doing?
Yeah.
And normally we would actually increase those. We'd go much more gradually, but time constraints being what they were.
Right. Exactly. So we have one question from Alicia. Alicia, do you want to ask a question or do you want me to ask it for you?
Either way. Good morning, everyone.
Hi, Alicia. You go ahead.
Thank you for the great presentations, both of you. I'm curious about I'm a big believer in the yoga, so that was nice to hear. I'm curious about the culinary medicine pursuits that Dr. Hayden was talking about, because I've been a big believer in how food can make a difference in people's health.
Sure. So, again, culinary medicine is a fairly novel area of study. There's certification through Harvard Medical. And really it's focused on getting patients in clinical care to better utilize their time and their kitchens for their own health. It doesn't adhere to a particular diet, so you're not really giving dietary advice, but it's more how to support patients to move towards better nutrition through home cooking and that sort of thing. And then the functional medicine side talks more about microbiota and dietary suggestions for that. So it's good to couple some training in both, in my opinion.
And how do you think that affects mental well-being or mental health?
Well, I mean, obviously, to me, as you mentioned, medicine is food. Food is medicine. So I think we need to consider that in healthcare, but also obviously in preventative health. There's specific diets that are recommended for Alzheimer's disease. We tend to recommend the Mediterranean diet, which is just a very healthy diet. But the reality is, if you tell a patient you should eat with the Mediterranean diet, they often need some guidance if they're not already eating that way. So that's really where the culinary medicine comes in, is how do you specifically support that and coach people through that.
And do you know, Sherry, how much evidence there is, like looking at sex-specific diets? So the Mediterranean diet and the Minds diet, there's some good data out there, but I haven't seen very much in terms of, this is working very well for women versus men.
I think there's a little bit that I can't sort of pull off the top of my head, but it's not prominent.
Yeah, I know.
As with much research, right? It's not prominent for sex specific differences. So that's a challenge.
Yeah. Yeah. Some of the small things I've seen are things like, the glass of red wine a day is great, but actually maybe more so for men than it is for women, which is kind of, they're few and far between the studies, so I don't think we can say very much about it, but I think it is important to always think about some of those recommendations.
I think I see a movement which is encouraging towards precision medicine, which is really focusing on the individual in the context of their histories, both interpersonally and socially, as well as medically. So that, I personally think that's really important as well.
Yes, absolutely.
Consider in all of these pillars of brain health that how to apply them can be difficult for some people depending on what their issues are.
Yeah, absolutely. Christine Atkinson, we only have 3 more minutes, but I think we can get to these 2 questions. If you want, I can ask your question for you. Since I don't hear anybody, I'm going to ask, which is, can you speak to meditation geared to neurodiverse populations? I've been reading about the focus meditations for ADHD, open heart medications for anxiety, etc., and or biofeedback and meditation.
No, actually, I can't. Maybe Dr. Hayden can.
I think we have to enter that meditation in itself with the breathing and having to focus can be, as I said, contraindicated in some populations. There's some, it would depend on the degree of issue in the patient. So there are some people who have more severe anxiety or psychotic disorders that really don't do well with meditation. It can increase their symptoms. I'm not familiar with other spectrums, like people on the spectrum, how they respond. And I would say that one would want to have a good sense of that person's history and what the response is to shorter term. You can start short, as Anne has said, and then expand. But I'm not aware of that area. It's kind of out of my area. But
well, I mean, I think you also talked about it a little bit in terms of precision medicine, right? I mean, if it was the other thing, my mom used to say, well, why haven't you figured this out yet? As you know, she had Parkinson's. Why haven't you figured out how to fix it? And I would say, Mom, it's complicated. Like if it wasn't complicated, we would have figured it out.
Yeah.
And so, and you did speak to that in terms of precision medicine, and that it's not a one size fits all. It's not a cookie cutter.
And that's the challenge as a clinician. It's great to have, and I realize as a researcher, you have to kind of hyper focus on specific issues and eliminate all other issues. But the reality of the front lines in clinical care is we don't get to do that. So I'm happy to see this concept of precision medicine. I think some of us have always practiced that way. I've always considered context of a patient that I'm seeing, but I'm glad that we're moving more towards that. But what is missing is the precision medicine component for women specifically.
Right.
In neurology, I would say.
Yeah, I completely agree. That's why we have this cluster, to bring a spotlight and attention to it. And I'm going to ask Sherry Dr. Hayden to write some papers with me about this. So if anybody is interested on the line that's a researcher and wants to help, or even not a researcher, please do get in contact with us. So
that. I love being with patients more than writing. So if someone else does most of the writing,
yeah, you can read that's totally fine. I can do that part, and you can fix it, edit it. No, I wrote down a lot of ideas, and I have a very funny story, but we are out of time, about being distracted. But so I'll save it for another time. But if you would all join me in thanking, you can use your little icons if you want, those little reactions, and thanking Dr. Hayden and Lyle for their fantastic presentations. Thank you. I do feel less stressed. Took me a long time to go from my heightened stress to my little less stress, but I do thank you. And hopefully I'll sleep better tonight because of it. So I really appreciate it. Thank you so much. And go to synaptictravels.com if you want to learn more.
Thank you. Bye-bye.
Thanks, guys. Thank you for joining us.
Thanks. Thanks, Lisa.
Thank you.